So Dr. Moss, tell me your story. What's your background?
I actually come from a family of dentists. I am an endodontist myself. Endodontists are dentists that specialize in doing root canal therapy, and I'm in the area.
I see. Now, given that you're a patient of Dr. Shay, what is it that you didn't like about your old smile?
Being in the profession, I was never satisfied with my smile. When I say that, I'm talking about my upper anterior teeth. I had a case of what they call microdontia, which are small teeth, and I had little gaps between my anterior teeth.
I see. Did it take you a long time to think about getting your smile worked on?
Well, I could think of as early as 1990s, maybe
Wow.
1995. I had always wanted to do something about my anterior teeth, but never really was active. Past, I would say 5 years or so, I've gotten multiple consultations from general dentist and prosthodontist.
Sounds like it took you a long time, and you're a perfectionist and very meticulous.
Have to be in my profession, yes.
Right. Now, what made Dr. Shayestehfar the dentist of your choice?
I actually probably have a little advantage over the average patient that might walk into her office. I have had the luxury of seeing some of her patients in my office. We as specialists grade general dentists and prosthodontists based on their skills and the laboratory that they use. I've seen a couple of her work, her full mouth reconstructions, and I was very impressed, and that kind of made me walk into the office for a consultation.
Very nice. Now, I've noticed you've mentioned the word prosthodontist a lot. A lot of people don't know what that means or what specialty a prosthodontist does. Can you explain to us?
Sure. A prosthodontist is a general dentist that has had 3 to 4 years in extra training in doing full mouth reconstructions. Full mouth reconstructions are cases where you have almost all the teeth either veneered or crowned, and it could be a multidisciplinary case where you have a periodontist, a gum surgeon, or an oral surgeon involved when you have implants involved and you have crown and bridge, and so on and so forth.
Seems like the process is very much involved. How was your experience like going through the process? Is it difficult?
It was more difficult to mentally make the commitment to carry out the treatment than physically sitting there and having Dr. Shay work on me. I'm a very difficult patient. I've had, again, multiple consultations. One of the main reasons that I think I had Dr. Shayestehfar work on me was when she initially had me come in, she did a mock-up exam on me where she placed white fillings on my 2 anterior teeth. It took probably less than 5 minutes. And she gave the mirror to me and she had me look to see what difference it would make. And I looked at her and said, Dr. Shayestehfar, I really like that. And she said, all right, let's take impressions, and we have the laboratory do a mock-up of the whole case. I actually ended up doing 8 teeth on my upper front teeth.
Wow.
After that, when I actually did make the commitment to have my veneers done, she had me come in, she anesthetized me, and she shaved down about 0.5 millimeter from all my upper anterior teeth. Went home that day with temporary fillings, temporary veneers, which were gorgeous.
So you had instant gratification?
Absolutely.
Wow.
One of those things that you start tearing up, but the permanent ones were actually cemented about a week and a half later. And they're porcelain, they're beautiful, they look great.
Seems like the process doesn't take that long.
It doesn't. It was about 2 hours, session 1, and about 1.5 hours the second session, yes.
Did it take you about 2 weeks to a month?
No, the whole thing from start to finish was about a week and a half.
Wow. Now, do you find yourself smiling a lot after your work has been done?
Absolutely. I do give a lot of lectures out, and I'm on the podium often, so it definitely does feel better to have a nice smile when you're in front of an audience.
Now, as a professional and a patient yourself, what would you advise people out there that are thinking about getting their smile worked on?
Being the difficult patient that I am, I know how hard it is for someone to want to step into a dental office and get the consultation done. It was such an easy, friendly environment at Dr. Shayestehfar's office that it really made me feel comfortable walking in. And she will do what's necessary, and she's very realistic in what she can or cannot be done, what she can or cannot do with someone's smile design.
Well, thank you so much for the time that you spent with us and sharing your experience, Dr. Maz.
My pleasure.
Thank you.